Welcome to COIQ, where you learn how health innovators maximize their success. I'm your host, Dr. Roxy, founder of Legacy DNA and international best-selling author of How Health Innovators Maximize Market Success. Through candid conversations with health innovators, early adopters, and influencers, you'll learn how to bring your innovation from idea to startup to market domination. And now, let's jump into the latest episode of COIQ. Welcome back, COIQ listeners. On today's episode, we have Kent Dix with us, who is the founder and CEO for Life365. Welcome to the show, Kent.
Hi, thanks for having me, Dr. Roxy.
Appreciate you. So tell our viewers and listeners a little bit about your background and what you've been innovating.
So for probably about the last 15 years, I've been involved in digital health and remote patient monitoring. This is my third company, Life365. The second company was a company called MedApps, which was probably one of the first IoT of healthcare, Internet of Things of healthcare, connecting things wirelessly at home and sending data back to the clinical backend so it can be reviewed by a clinician. That company was acquired by Alere Abbott several years back. We left and started Life365 because we realized, and it's actually being proven out now with COVID-19, that we need to do more with less resources, more in connecting patients, keeping the demand of patients off of hospitals and ERs, and trying to stabilize and trying to remotely connect to be able to increase access to healthcare and drive down costs.
So when did you start Life365?
We started it back in 2016. We were working on initiatives to help with getting reimbursement out. Reimbursement was slowly starting to come out. There's a few codes that emerged in 16, 17 timeframe. In that same timeframe in 16, we realized that AI and analytic systems were starting to develop, and we realized that they were going to be very hungry for cost-effective, actionable data. And probably the hardest thing for any system to do, healthcare provider or even healthcare integrator or system integrator, was trying to connect the last mile to the home to try to get that actionable data. Now we've seen a lot of disparate solutions that have appeared in the marketplace that are approaching seniors, and we found that they're disparate, they're not integrated, they're not on a curated platform, the patients aren't engaged. And so we're trying to solve that equation and trying to connect that last mile.
So take us through this journey the last 4 years. What were some of the milestones or successes along the way? And then what are some of the challenges that you were facing? And I'm going to kind of say pre-COVID, because I think the world's changed, and we'll talk about that after. But prior to COVID, what were some successes and some challenges that you were experiencing?
So I'll start with the challenges first. I mean, I usually talk about, friction points, and there's been friction points along the way in healthcare. We know that we've got to do more with less. We sit here, and if I talk to CEOs of health system and say, 10 years from now, are you building more billion-dollar investments in health systems that are out there brick and mortar, or are you connecting into the community? And they'll say, definitely connecting into the community. But the friction points from that are, if I'm going to do that, how does it get integrated into the clinical backend system? How does it get paid for? What solutions, digital health solutions of the hundreds, if not thousands that are on the market today, are integrated and seamlessly flow to the backend? And how do you choose which ones got efficacy for a client or not, or a patient or not? Logistically getting it to the patient, logistically setting it up, engaging the patient. If you think about all that kind of goes with it, yes, there are solutions that show up in the marketplace that may do diabetes, right? And have done very well, but they can engage their diabetic patient, but that's only one sliver and function or personality or persona of that patient. Yeah. They've got a lot of other needs. They may have social determinants of health needs. They may have other comorbidities. And we've got to be able to look and personalize care towards that individual. The one thing I know going forward is that we're going to be driving towards, we're not only driving towards value-based care over the last 4 years, actually 6 years, but we're now actually going to be driving towards consumer-based healthcare. So consumers will make the decision on how they get healthcare in the future. They're already starting to do that. And that is a little bit setting the healthcare industry on its ear, because they're trying to figure out, how do I connect to a consumer? How do I engage with a consumer? How do we get paid for engaging with a consumer? But the marketplace is not stopping to let the healthcare industry answer that question. The marketplace is adopting and going forward, whether it's Amazon Health, whether it's a Teladoc MD Live type solution that's out there. Consumers are demanding on a regular basis how they're going to engage with healthcare. And healthcare has got to determine how they service the consumers for the future. Right?
So how is that? How are those obstacles and challenges in the industry or opportunities affected you as an entrepreneur in being able to take your idea for Life 365 and kind of manifest that into something that you could launch?
Yeah, I think, it's interesting. I think we've done this before. I think part of the thing that stifles this industry a little bit is investment, right? So investment has been somewhat, although there's been large investments made in digital health, and unicorns have been created. The smaller investments, and I'm talking about $10, $15 million entry points for Series A's, have had some challenges out there because of reimbursement, because of adoption from health systems. If you had a solution that was very, disparate and single focus, maybe towards a disease state, I'll just take diabetes, and had a reimbursement code on the other end, or payment code like was from large self-insured employers, that was more likely to be adopted and invested in because it's a repeatable cycle to be able to latch onto. I tend to move more towards disruptive platforms. Mm-hmm. I tend to move towards trying to look across multiple disease states and looking at an individual personalized. From that, that's much harder because there's not a predicate in the space that's really doing that. Right. From that perspective. And the other thing from it as well is that healthcare is not necessarily, asking for it. And now remember, we're talking about this pre-COVID, right? Yeah. So they weren't necessarily asking for it because they're still figuring out, like, I still need to have people that come in the hospital so I can make money, right? Yeah. I still need to do elective surgery because that's where I make my money. I can't take care of, patients remotely and not get paid a fraction of the cost. I've got to be able to figure out and decide how do we pay for our doctors? How do we pay for our infrastructure? And then the other thing is doctors are personally challenged, and I really feel for them as well, because they're like, I do want to have a life. I want to be able to turn off for 3 or 4 hours to go to my kid's soccer game and not have to work, another 2 hours or 3 hours a night just filling in the electronic health record. And so we can get billed, right, as well, and make sure I didn't make a mistake, right, mm-hmm. as well. So there's a lot of empathy in my part that goes around the clinicians and physicians with this stuff. But I'm also the type of person that's not going to go and say, I'm not going to just build a system because it gets a clinician more money, right, or more billing. I'm trying to solve the problem that exists. And the problem that exists is greater access to care and lowering healthcare costs, mm-hmm. right? And so they shouldn't be diametrically opposing viewpoints, right, with this. I mean, we should be able to bring new methods of how physicians bill, right? I always call it the Uber model, right? Mm-hmm, and mm-hmm. we should be able to bring in solutions and technology around it to be able to satisfy consumers living independently and to reduce costs, right? If we implement, and get the right data and we drive it through analytic and AI systems, maybe, in the future, I think that actually AI actually might be reimbursable for monitoring a patient, right? And maybe they should be, because mm-hmm. they're sitting there looking at trends and patterns and only bringing it to the alert of the PA or the clinician, if there's something that's maybe out of pattern that needs to be looked at, right, yeah. from it, right? So, you asked initially about successes. We've been very, very fortunate to be part of Plug and Play, which is out of Silicon Valley recently. Plug and Play Health Cohort, they're in 34 different countries. They try to bring the best and the brightest around. There was 900 companies that were interviewed. It was whittled down to 18, and they've worked with us over the last 3 months to introduce us to industry leaders and thought leaders. And we've had some really good introductions to, I'm talking about the largest tech companies in the world, mm-hmm. To be able to work with. And then we've been fortunate to be part of Mayo Clinic, right? And their accelerator that started last year from this. Just some really good recognition along the way of what we're working with. And remember, we're still talking pre-COVID, right? So when you want to go to talk about COVID, the world has changed dramatically for us.
So how did those, like Plug and Play and Mayo Clinic, how did those come about? I know that our listeners and viewers want to know, how do they get access to those types of partnerships and relationships and, just pathways to success?
We'll start with Plug and Play first. Plug and Play is always looking for the best and the brightest, always. So, right. So, you can always reach out to, it's plugandplay.com or pnp.com. And they have different sectors like for insurance and fintech and, healthcare. And I think they probably have about 15 different verticals. And if you go to their facility in San Jose, one of the facilities, they've got placards of every major company that's working there. So it could be American Airlines and Delta and American Express and Humana and Cigna and Aetna and all those Blue Cross Blue Shields. They're all working there because they want to see if they can get a first peek or first bite at the apple with new tech that's coming. Mm-hmm. So I would reach out at any time, right? Or if anybody wants to contact me, I'll make a recommendation to Plug and Play, and they can be put up for the next cohort, right? To be able to look at it. The other one with Mayo Clinic has put out, an initiative a little over a year ago, to try to find the best and the brightest as well in med tech, and they selected 6 companies from around the world. Because of COVID, around the country actually, because of COVID, it's delayed their next cohort, but they'll be doing another one here probably in either the fall or the spring. And it's something that you should grab on and work with them on. It's great. It's Arizona State University and Mayo Clinic, and they'll probably expand it so it's Rochester based as well. But this one is Arizona with Arizona State University. There's a lot of, just to really as a side note, there's a lot of great things that are starting to happen in Arizona. Arizona is getting some really big initiatives around healthcare. We've got large investments that are coming in to create big, large complexes for healthcare to try to disrupt and do healthcare differently. And the good thing is that we're involved in that. And disruption is kind of, is my middle name, right? A little bit. I try to do it in a very, very positive manner, but I'm trying to deliver care the way that the consumers want to deliver care. And that's actually equally as satisfying to the provider as well.
So let's talk about that and segue into kind of in the midst of COVID or, beyond COVID. So you talked about some different market trends with, consumerization and them being more in control of the buying decisions that are happening and the challenges with access to care and lowering cost. All of those things have been affected by COVID in some form or fashion. So how is it affecting you and your business? Is it creating more barriers? Is it creating opportunities, and what that looks like?
Definitely creating opportunities. And the one thing that I will say over and over again is that one solution doesn't fit all, right? When you've seen one digital health solution, you've seen one digital health solution, right? From that, that you really got to understand who you're trying to serve. And so one of the large companies that we're working with right now, they're like, it's fabulous what you guys are doing. Let's just go ahead and put it across all 120,000 employees that we have. And my first response is, hooray, that's great. That makes my day, right? To do that. Right. But it won't be successful, right? Because you've got to understand who you're engaging with and how they're going to engage with your technology and how they want to engage with it as well. Now, this large self-insured employer, I could look at their retiree base and say, that's probably where a lot of your money's being spent. And they're probably, over 70 years old or even actually 65 years old. They're probably going to engage a certain way from that. And they've got comorbidities. And so let's look at them a little bit differently than we look at a millennial that's sitting at the other end that's not going into the emergency room and wants to engage on maybe their healthcare on a telemedicine app, right? From that, or order their supplies through Lemonade or through other services that are out there. And get their birth control pills a certain way and get engaged a certain way. You have to look at this differently. Yeah. So I think any successful program, that's going to be put out there I'm just guessing about Amazon. Everybody's guessing about Amazon. And that's a beautiful thing about it, is that they're actually getting input from all of us about what we think that's going to look like, and then feeding it in, and maybe actually actually go through and create a system based on all the feedback they got right from it. So that's my biggest thing, is to go through and try to align the right solutions with the right technology, or right solution with the right patient, to get the right outcome at the right cost, right? To do that, we just can't go and throw something at the fences. And that's why we went through and took a variety of solutions and put them on a common platform that people actually can. It's almost like a marketplace where people can go through and pick and choose what they want, whether it's for their mom or dad that's staying independently at home, or whether it is for a group of employees that are concerned about coming back to work, right? Or coming back to work after COVID-19, right, from that as well.
So as you think about your commercialization strategy and that process, as you've kind of gone from, an idea to, adoption, I have customers, I want more customers. What's next for you for Life 365? What's changing? What's different about your commercialization strategy in the midst of COVID and what's happening?
Yeah, so we continue, although consumers use our solution, we continue to be, sorry about that, we continue to be a B2B play.
Yep.
So we align with strategics that are actually that may be financially responsible for their patients, or they're trying to solve a problem around a large patient population and working with them. It's interesting, a number of healthcare systems are starting to reach out to us because they have a couple problems. They had a problem before COVID-19, which they're starting to see slowly patients walk away from their healthcare system, and they're trying to say, how do I keep them? Because I'm not doing what they want to do, they're going and finding better ground where they can get the services that they want. COVID has just, in my viewpoint, it's taken the inevitable of what was going to occur and just accelerated it,
Completely.
Right. So, whether it is how we go to restaurants, whether it's how we see movies and how we interface with people, right, or how we get healthcare, it's all accelerated now. And so that's, part of this, as we go back and say, is this the new normal, or is this actually going to go back to the way it was? And I think there's a hybrid to this, right? I think I was even watching TV today and seeing all the anchors that are from their home. And every morning they had to be picked up in a car and taken to the studio in New York City to do this. I'm like, why? Why do they have to do that in the future? Right. From that. Right. I mean, we are all missing a couple different things. I've been working from my home for the last 2.5 months. I'm probably having to adopt, better habits around exercise and getting up from my chair, because work forced me to kind of get up every half an hour and go take a walk, or go visit somebody else, or take time off for lunch and have a non-work conversation.
At least walking to the conference room.
Absolutely. Or, starting at 9:00 in the morning, not 6:30 in the morning, and leaving at 6:00 at night and not working till 9:30 at night, right, to do that. It's just too convenient to get up, take a shower, and start working, right, from that. It's highly productive. It may not be healthy for us. So I think I think that's not a new normal. I think there's part of a hybrid that's going to have to emerge out of that as well. But I think part of the new normal is going to be how people adopt this technology. We've seen, part of this figure I haven't actually validated all the way through, but somebody reported the other day that they saw a 2% penetration and adoption of telehealth in the marketplace. And Teladoc's doing well and MDLive's doing well. After COVID hit, it went overnight to like 70%.
Yeah.
Like me personally, I've done now 2 telehealth visits since that time. And the interesting thing is, because I have it, I'm sitting here with an AliveCor, a pulse oximeter, a thermometer. So I go through and do my AliveCor, I do my pulse oximeter, my weight, my blood pressure. I put it into a chart and I give it to my doctor, and then I go do my telemedicine visit. So he has everything he needs on one side of the screen when we're visiting, right, to look at it, my medication adherence as well. That's all going to be, I think, normal. And before COVID hit, we're partners with Sonora and Quest here in town. Arizona is a little bit different because we can actually request our own labs if we want to. We don't have to have a doctor order, and we can request our own labs. But the doctor ordered labs, it used to be that I had to go to the doctor to get an exam. I had to go back to get testing. I had to go back in to get the test results. Now I go online for a telehealth visit. They order the labs from the same computer I'm doing.
Yep.
The nurse comes to my home and takes my blood from that. And then the next day, the results, or next day or two, the results are in my electronic health record. So healthy or not, I didn't have to leave my computer at all to be able to have the conversation with my doctor, right, to do that. So that's not going back.
It's not. No, I agree. Right. Hey, it's Dr. Roxy here with a quick break from the conversation. Are you trying to figure out what moves you need to make to survive and thrive in the new COVID economy? I want every health innovator to find their most viable and profitable pivot strategy, which is why I created the COVID Proof Your Business Pivot Kit. The Pivot Kit is a step-by-step framework that helps you find your best pivot strategy. It walks you through 6 categories you need to examine for a 360-degree view of your business. I call them the 6 critical pivot lenses. As you make your way through this comprehensive kit, you'll be armed with the tools, tips, and strategies you need to make sure you can pivot with speed without missing out on critical details and opportunities. Learn more at legacy-dna.com/kit. So you had all of these healthcare institutions, like you had described earlier, who were, making the highest profit margins by being able to have care in their brick and mortar facilities. And reimbursement was still structured to support that model. Now with COVID, you have a pandemic that's, where now providers and, these large organizations are, you can't come in and we don't want you to come in. And so that's being shifted to the home. Where do you envision reimbursement fitting into this and kind of catching up? I know we've seen a lot of things relax, like for telehealth, that's really opened up the gateway for that, from 2% to 70% greater adoption. But, as we think about remote monitoring and digital therapeutics and what's happening in the home and in the community versus the brick and mortar, how do you think reimbursement fits into that equation, and when?
So you got to remember, reimbursement's full open right now. Right from us. We got to remember reimbursement is about parity and licensure and, 1135 waivers and everything that kind of goes into it. And all that's been incredibly relaxed, over the last, couple months or so because of COVID-19. You also have to remember that the pandemic's probably going to be with us another 12 or 18 months, probably at least another 12 months, until we really start seeing a vaccine that comes with it. Because remember, the virus is also mutating, right, as well. And so even though we're working on a vaccine right now, is it the right vaccine, right? So there's a lot of different things that are at play right now. So we don't see that reimbursement going back to anything close to where it was before. I think there was like 23 states that were in a compact for licensure that anybody could monitor anybody within those 23 states. Right now, it's fairly open.
Yeah,
right? The 1135 waivers are open so you can monitor anybody else. I'm pretty sure that's going to stay, right, from that. The only reason why you would pull it back is a level of protectionism, right, to protect, the healthcare workers in your state, but it really doesn't, right, do that. It opens you up to actually monitor other people in other states. And then parity, where whether you're in the office or whether you're remote, from that, you get the same billing fee. That's pretty much in operation today, and allowing you to bundle other fees with it as well. I don't see that completely going away either, right, as well. So what's the negative side that's going to go away? They had requirements a lot of times from originating site, like it had to be video or it had to be, from a healthcare location back to another healthcare location. That's been kind of taken away. I don't see that going back as well, right? So, what's going to push this is consumers. The interesting thing about this is that the resistance that I saw a lot of times to reimbursement was that 2%. It was the healthcare industry, even though the AMA was involved in this, was the healthcare industry saying, we don't know how to compensate our doctors. We don't know if our doctors are going to like this, right? We don't know how they're going to be able to take care of patients in the practice and still be at home. And now with that 70%, they're like, shoot, I want to do this, right? So,
I should have done this 6 months ago. Damn.
Or 6 years ago. Yeah.
Right. Exactly. Yeah. Better yet.
Yeah. So, they're going through and saying, wait a minute, there is a better way to do this, because now I can actually have freedom to put a PA on this, right? Instead of me doing it to monitor patients. I get paid for it. I get a little bit more freedom and time in my practice to be able to do stuff. We're not having to drag everybody that's sick and decrepit in all the time and putting more strain on themselves. We can actually allow them to be in their own originating point where they live, and we can just do a visit like this. What's the problem with doing a visit like this?
Right.
With your doctor, right? To do that.
And of all the doctors that I've talked to over the last couple of months, not one of them has had a negative experience or feeling towards what's happening. For them, it was always the financial factor. And, if I can get compensated at the same level for a virtual visit, then I'm all for it.
Yeah, I think CMS's biggest concern over the time has been fraud, right? So that, technology will just propagate quicker fraud, right? That's out there, that people can say they're doing interactions like this and then bill for them and over and like bankrupt the system. They're just not finding that, right? Yeah. They're finding fraud. They're finding some fraud, but they're not finding it on mass scale, right? To do. And that's part of the reason why they didn't open up these billing, so quickly. I mean, we had a lot of Medicaid and Medicare fraud down in Florida, right, and other places around. They shut down a lot of those rings out there. A lot of it was around diabetes, right, and logbooks and everything else.
Yep.
And supplies and everything else that went with it. And that's part of the reason why they took the reimbursement out of the diabetes as well, right, to take the profit margins. There's a lot of reasons why they did, but they take the profit margins out from a fraud standpoint as well.
Yeah.
So I don't see it going back, right? I just don't.
So this show is all about healthcare innovation, but not the technology as much. There's plenty other shows out there talking about that, but more of the commercialization strategy, the strategies and tactics that health innovators, whether they are in a small startup, emergent company, or whether they're even kind of an innovation division in a larger institution, but how do they navigate the commercialization process or strategy to increase their chances of success, because the odds are generally stacked against them. The failure rate is really high. So what advice do you have for our viewers and listeners who are in the trenches right now? Maybe their pre-COVID market strategy isn't effective. They're not sure whether they're even relevant today or not. Or maybe they are and still trying to adapt to what you call, what we're all calling the new normal or beyond COVID. Right. What advice and guidance do you have?
I think you have to be realistic about where you're at on things as well, long term. I mean, people are even looking at us and saying, okay, that's COVID. You got the next 12 to 18 months, but what's your market after that? To us, it's not a pivot. To us, it's a refocus, right? Of just dealing with, sorry about that, a disease state. And COVID just happens to be one of them, using our platform and technology to do that. So in the long term, we're always going to be connecting people. We're always going to be needing to get data and bring it back to the analytics system, the AI system. So it's always part of the core, right, with this. But right now, as we're out talking with people, it depends on who they are. But everybody, we had one insurer say yesterday, I love every solution you're doing. Just bring everything to me that's COVID-19 related, because they don't want to think about anything else right now. So you've got to be realistic about what their pain points are. Our viewpoint is, although a large swath of the country believes that COVID's going away, right, and that things are settling down and that we're on the other side of, the curve, and, maybe we need to even bend the fear curve that's out there as well. My big belief is, and industry doctors believe, is that there's a tsunami getting ready to go over us. And part of it could actually be self-inflicted as well. I understand the economy. I understand that we're having to get out and make sure we have commerce and everything else, but that a lot of us are creating our new commercialization remotely and still staying safe. And I realize all that as well. But all indications are saying that fall, winter, and spring are going to be probably 5 to 10 times worse than what we just went through. And our health system was maxed, right? Was maxed, at this last thing. So what does 5 to 10 times worse look for you? 5 to 10 times worse means that I can't get devices and stuff out of China, right? From that to be able to monitor people. 5 to 10 times worse means I don't have enough healthcare resources, right, to be able to do that, or enough PPE, right, to be able to do it. And who knows if you're creating massive amount of ventilators, if that's the prescribed therapy that's going to be needed in fall. And fall is going to bring us flu, right, as well. So the thing I would say to entrepreneurs, and this is kind of what we're doing with some large tech companies right now, is stay agile, right? Go to your core, right? Listen to the needs of individuals that are out there, what they need. If they're asking for COVID, don't keep trying to sell them HR solutions, right, from that, because they're probably not listening to it when they're laying off people.
Yeah.
Try to reinvent yourself, from that standpoint, off of your core. So give me an example. Let's say you are selling HR solutions that are out there and going, well, it's a COVID world, I can't do anything around that. That's not true. You can put procedures and policies in place to try to help people get back to work faster and safer. Right? Do you put policies in place for testing?
Right.
What are the legal ramifications around that? Do you do surveillance with it? Do you do assessment on a regular basis? Change your HR viewpoint change your viewpoint in general about what your audience wants to hear. Now, this is me preaching to the choir, and I don't take my own advice. But one thing I would do as a young startup is try to latch yourself onto a strategic as much as you can, right? And I would try to go through and find a very small project that you can do for them that they're not doing themselves, and as a proof of concept, and get going, right? And just repeat it over and over again. Try not to use the words pilot, right? Try to use the words initial assessment, right? Or initial rollout, right? From that, because you want to build upon it with them, right? You don't want to just be a pilot, good results, and then gone, right? As well. But focus it towards what the strategic needs.
So that's really wonderful. I want to, pick your brain for one other thing here when you use the word focus. So we hear a lot with, just the whole world of entrepreneurship is, always telling entrepreneurs to focus. Don't get sidetracked by the next shiny new thing. And there's this balance that I think between I got caught up in the shiny new thing, especially in this market, right? As you describe it, for the next 12 to 18 months, things are going to be so dynamic and ever changing. And so, I think we have this balance for entrepreneurs between I need to be agile, but I also need to focus. And how am I balancing between reacting to the changing market conditions that might be different in 60 days, that might be different in 180 days, and being able to stay the course, but not stay the course towards failure, and being able to reinvent myself and go to a new path. But how many times do I have to do that over the next couple of years?
Right. Yeah, it's interesting. I'm going to be very hypocritical about this because I'm probably the least focused, person in our company. But the good thing about this is that my company around me focuses on very specific projects to try to drive into revenue. From my viewpoint, I am doing strategy and vision, and I am putting out in our core competency, I'm putting out tentacles that are out there to be agile and working with our clients and see where they want to go right, with this as well. But you've got to be able to have focus as part of your team to be able to implement that. That's what's going to drive revenue. And that's exactly what we do. As I'm pitching on the metaphor of baseball, I've got great, fielders and catchers that are out there really making the whole game work right from that. And it's part of a team effort. And I've got a great team to do that. And you've got to surround yourself by great teams. And that includes trying to go get great champions for you that are with strategics to do that. Again, I'll plug and play one more time. Plug and play it's hard if you approach a strategic directly as a young company because they've got so many rules, right? Even trying to get an NDA signed, they're going to go, this will take 3 weeks to do. And is it worth it because of what you're going to deliver? Plug and play is the intermediate behind that, because the strategic has approach plug and play and saying we want ideas from young companies, and being the facilitator to get the ideas from the young companies and making the relationships work, right? So if I was going to lead anybody, to do this and say, do you go approach 3M directly, or do you go to plug and play and let them make a relationship? I would do that. Every day, right?
Absolutely. That makes so much sense. So Kent, thank you so much for sharing your wisdom with our viewers and listeners today. How can folks get a hold of you if they want to follow up with you after the show?
Sure. Our website is life365.health. My email is kdix@life365.health. Please feel free to reach out to me. I'll try to make any connections I can.
Awesome. Thank you so much.
Thanks, Dr. Roxy. I appreciate it.
Thank you so much for listening. I know you're busy working to bring your life-changing innovation to market, and I value your time and your attention. To save time and get the latest episodes on your mobile device automatically, subscribe to the show on your favorite podcast app like Apple Podcasts, Spotify, and Stitcher. Thank you for listening, and I appreciate everyone who's been sharing the show with friends and colleagues. See you on the next episode of COIQ.